P syndrome, Western differentiation, reactive arthritis, Reiter's syndrome. RA, formerly known as Reiter's syndrome, is a non-infective type of inflammatory arthritis triggered by an infection in another part of the body, most often the gastrointestinal or genitourinary tract. The bacterial infections most commonly associated with RA are Salmonella species, Campylobacter jejuni, Shigella species, Yersinia enterocolytica, and Yersinia pseudotuberculosis in the GI tract, and chlamydia trachomatis in the genitourinary tract. Yet, some cases of RA have been reported secondary to viral infections or caused by other bacteria. The mechanisms underlying the pathogenesis of RA are still unclear. However, the autoinflammatory response appears to occur in subjects predisposed due to the infection. Genetic factors may also play a role in disease susceptibility. The HLA-B27 antigen, in fact, is present in many individuals with RA. However, it is important to note that the majority of patients who develop RA are HLA-B27 negative, so the genetic component of RA is not fully understood. When a preceding infection is recognized, symptoms of RA appear in about 1 to 3 weeks after the infection. However, it is not always possible to isolate the causative infectious agent. Patients with RA can develop symptoms such as the classic triad of arthritis, urethritis or cervicitis, and conjunctivitis. Few patients present this triad alone because RA may affect many different parts of the body. The predominant manifestation of RA is acute asymmetrical oligoarthritis, most commonly affecting the lower extremities. Clinically, RA resembles the other forms of spondyloarthritis, such as psoriatic arthritis or ankylosing spondylitis. Urogenital tract symptoms. RA often affects the urogenital tract, including the prostate, urethra, and penis in men, and the fallopian tubes, uterus, and vagina in women. Men may notice an increased need to urinate, burning sensation when urinating, and a discharge from the penis. Some men with RA develop prostatitis, inflammation of the prostate gland. Symptoms of prostatitis can include fever, chills, increased need to urinate, and a burning sensation when urinating. Women with RA also develop signs in the urogenital tract, such as inflammation of the cervix or inflammation of the urethra, which can cause a burning sensation during urination. In addition, some women also develop salpingitis or vulvovaginitis. These conditions may or may not cause any symptoms. The arthritis associated with RA typically affects the knees, ankles, and feet, causing pain and swelling. Wrists, fingers, and other joints are less often affected. Patients with RA commonly develop inflammation where the tendon attaches to the bone, a condition called enthesopathy. Enthesopathy may result in heel pain and the shortening and thickening of fingers and toes. Some people with RA also develop heel spurs, bony growths in the heel that cause chronic or long-lasting foot pain. Arthritis in Reactive arthritis can also affect the joints in the back and cause spondylitis or sacroiliitis. Conjunctivitis develops in approximately 50% of people with urogenital RA and 75% of people with enteric RA. A few people may develop uveitis and inflammation of the inner eye. Conjunctivitis and uveitis can cause redness of the eyes, eye pain and irritation, and blurred vision. Eye involvement typically occurs early in the course of RA, and symptoms may come and go. Approximately 20 to 40% of men with RA develop small, shallow, painless sores or lesions called balanitis circinata on the end of the penis. A small percentage of men and women develop rashes of small hard nodules on the soles of the feet and less often on the palms of the hands or elsewhere. These rashes are called keratoderma blennorrhagica. In addition, some people with RA develop mouth ulcers that come and go. In some cases, these ulcers are painless and go unnoticed. Approximately 10% of people with RA, usually those with prolonged disease, develop heart problems, including aortic regurgitation and pericarditis. From the perspective of Chinese medicine, RA manifests with symptoms of damp heat and toxic heat. Thank you for your attention.